If your baby spits up after almost every feed, it can feel like something is wrong. Is this just normal baby stuff or is it reflux? The truth is, most spit up is harmless, but sometimes it signals that your baby's in pain or struggling. In the next few minutes, I'll help you tell the difference so you know when to relax and when to take action. Hi, I'm Cherry, a certified maternal and newborn nurse, and I will break down the confusing stuff in plain language so you don't waste your time on late night Google spirals. Let's talk about spit up versus reflux. What's normal, what's not, and what you can do to help your baby feel better starting tonight. Here's the deal. Most spit up is simply a plumbing issue, not a health problem. Babies have tiny tummies. Their digestive system is still learning, and the little muscle that closes the stomach is not strong yet. Add in the fact that babies spend a lot of time lying flat, and milk has an easy way of sneaking back up. So yes, it is messy. It stains the onesies, and it ruins your outfit. But if your baby is feeding well, gaining weight, and otherwise content, spit up is just part of the newborn period. It usually peaks around 2 to 4 months and gets better as your baby spends more time upright and their muscles mature. Now, if you want all of this broken down in easy steps, I built a free private resource hub just for moms like you. Inside, you'll find my guides, my checklist, and newborn care tools that make the first months so much simpler. The link's in the description, and you can join free today. Reflux isn't just about volume, it's about comfort. Babies with reflux act like spit up hurts. They may arch their back during or after feeds, cry or fuss as the milk comes back up, or push away even though they are hungry. Some babies gag, hiccup constantly, or cough after nearly every feed. And if reflux is severe, you might notice your baby is not gaining weight well because they're not keeping the milk down, right? Does that make sense at all? That's when it's time to check in with your pediatrician. There are simple things you can try that make a big difference. First, hold your baby upright for 20 to 30 minutes after a feed instead of laying them down right away. Second, offer smaller, more frequent feeds so their little stomachs isn't overloaded. Third, burp them gently throughout the feed. Don't wait until the very end. If you're using bottles, make sure the nipple flow isn't too fast so they're not gulping air. And if you're breastfeeding and your letdown feels like a fire hose, hand expressing a little before latching or using a laid back position can help. These aren't fixes for true reflux, but they can ease everyday spit up and keep your baby more comfortable. There are times when spit up is not just spit up. Call your pediatrician first. The spit up is green or has blood on it. Second, your baby is projectile vomiting, meaning it shoots across the room. Third, they seem very tired, don't want to feed, or are not gaining weight as expected. These are red flags that require medical attention, and you should never hesitate to call and ask. So here's the bottom line. Spit up is usually just laundry duty. Reflux is when your baby shows signs of pain, discomfort, or poor growth. If you'd like more clear, step-by-step newborn resources, join my free private resource hub. You'll get access to my best guides that help you feel calm and prepared during the postpartum period and the newborn phase. The link is below. And if nights are still a struggle, don't miss my next video. I'll help you cut through the noise and find what actually works for better rest. Thanks for being here. I know this period has a lot of you, And the fact that you're seeking out support tells me you're already doing something powerful for yourself. If this video helped make the newborn phase feel less confusing and more manageable, please subscribe and like the video so you don't miss what's next. And when you're ready for deeper, structured support, I've linked that below too. I'm Cherry, and I will see you in the next one.